Unlocking Emotional Resilience, Integrating REBT and EFT in Therapy. In this introductory section, we aim to provide a clear context for the integration of Rational Emotive Behavior Therapy, REBT, and Emotionally Focused Therapy, EFT, emphasizing the significance of this integration in contemporary psychotherapy. REBT, developed by Dr. Albert Ellis, is rooted in the ABC model, activating events, beliefs, consequences, and focuses on cognitive, emotive, and behavioral interventions to alleviate emotional distress and dysfunctional behaviors that tend to impede an individual from attaining desired life goals. It is well known for its cognitive interventions in the form of cognitive restructuring that involves identifying, challenging, and replacing dysfunctional beliefs. On the other hand, EFT, pioneered by Dr. Sue Johnson and Dr. Leslie Greenberg, revolves around attachment theory and emotional regulation, with an emphasis on nurturing secure emotional bonds within relationships. These therapies diverge significantly in their theoretical underpinnings and techniques. The rationale for integrating REBT and EFT lies in their potential synergy. By combining the cognitive, behavioral, and emotional aspects of therapy, practitioners can offer more comprehensive and effective treatment for clients. This integration is especially beneficial for clients with a wide range of mental and emotional disorders, as it provides a multifaceted approach to healing, addressing both cognitive distortions and emotional dysregulation, strengths of both REBT and EFT. Understanding the foundations. Let's consider briefly the foundations of these models to deepen our understanding of the foundational principles of REBT and EFT to establish a clear grasp of their theoretical underpinnings. REBT is grounded in the ABC model, which posits that external events, activating events, trigger our beliefs, which in turn lead to emotional, behavioral, and even physiological consequences. REBT therapists work with clients to identify and challenge irrational beliefs, helping them restructure their thought patterns for more rational and adaptive responses. This cognitive approach equips clients with essential tools for emotional self-regulation and resilience. It also uses emotive interventions that directly work on emotions, and it also uses behavioral interventions. Working on all three fronts is grounded in REBT theory that holds that cognitions, emotions, and behaviors are either independent, not linear phenomena, but are constantly interacting, much as the diverse brain areas interact. In contrast, EFT is firmly rooted in attachment theory, which underscores the fundamental human need and desire for secure emotional bonds. EFT therapists focus on helping clients recognize and express their emotions, fostering greater emotional regulation within the context of relationships. The therapy aims to create secure attachment bonds, promoting emotional safety and trust, which are held to be crucial for emotional well-being. Major distinctions between REBT and EFT. Having a rudimentary understanding of the foundations of each theory, we will briefly consider some key distinctions between REBT and EFT, which are pivotal for understanding their integration. The primary contrast between these therapies is their focus. REBT employs cognitive, behavioral, and emotive approaches in which at the cognitive level beliefs, and to a lesser extent intentions, are examined, and dysfunctional beliefs, that is, beliefs that disrupt the attainment of desired life goals, are identified, challenged, and replaced with functional, adaptive beliefs. EFT, conversely, takes an emotionally focused approach, prioritizing the recognition and regulation of emotions within the context of relationships. This work has important implications for an individual's cognitions and behaviors. Thus, the differences, while important, are to some degree a matter of focus. While REBT centers largely but not exclusively on belief systems, EFT prioritizes attachment bonds. REBT seeks to identify and change irrational beliefs, dysfunctional behaviors, and dysfunctional emotions that contribute to dysregulation and distress, whereas EFT seeks largely to strengthen emotional bonds to alleviate emotional distress. REBT often collaboratively sets specific goals for clients, emphasizing the outcomes the client desires. In contrast, EFT places a strong emphasis on emotional responsiveness and the process of emotional exploration and expression, without strongly defining goals from a therapist's perspective. These differing orientations are essential considerations when integrating these therapies. The power of integration. Now let's explore the potential benefits of integrating REBT and EFT, emphasizing their synergistic potential for client well-being. The integration of REBT and EFT can be highly complementary. REBT equips clients with cognitive, emotive, and behavioral interventions that at a basic level help to identify and challenge dysfunctional beliefs, behaviors, and emotions, while EFT provides a framework for exploring and regulating emotions within the context of relationships. Together, they offer a more comprehensive approach to addressing complex emotional issues. Examining real-life case examples illustrates the power of integration. For instance, a client struggling with anxiety and attachment issues may benefit from REBT's cognitive restructuring techniques to challenge dysfunctional beliefs and inferences while simultaneously using EFT to navigate and heal attachment wounds. This integration is particularly advantageous for clients with a wide range of mental and emotional disorders. Whether dealing with anxiety, depression, trauma, or relationship issues, the combined approach allows therapists to tailor treatment plans to address both cognitive, behavioral, and emotional aspects of these disorders effectively. Practical interventions. Let's talk specifics, that is, what might be the integration of specific interventions from the models. This may offer therapists concrete strategies to use in clinical settings. Therapists can seamlessly integrate REBT and EFT techniques by using cognitive restructuring alongside emotion-focused interventions. For example, when working with a client struggling with trust issues in a relationship, therapists can employ REBT to identify dysfunctional beliefs about trust and then use EFT to explore and address the underlying emotional concerns. The integration allows therapists to address cognitive and emotional aspects simultaneously, providing clients with a more holistic and efficient treatment experience. Clients learn not only to identify dysfunctional beliefs but also to connect these beliefs to their emotional experiences, fostering deeper self-awareness and emotional regulation. Another advantage of integration is the ability to customize treatment plans to meet individual client needs. Therapists can adapt the balance between REBT and EFT techniques based on the client's presenting issues, preferences, and progress, creating a tailored and effective therapeutic experience. Ethical considerations in integration. What might be some ethical implications of integrating REBT and EFT to ensure responsible and effective treatment? Informed consent is crucial when integrating therapies. Clients should be informed about the integration process, the theoretical foundations of both therapies, and the potential benefits and challenges. Collaboration among therapists from different therapeutic backgrounds is also essential to ensure a cohesive and ethical treatment approach. While integration offers numerous advantages, therapists must remain vigilant in maintaining appropriate therapeutic boundaries. Ethical practice requires therapists to avoid overstepping their competence in either REBT or EFT and to seek consultation or supervision when necessary. Challenges and limitations. What might be some of the challenges and limitations associated with integrating REBT and EFT? One challenge is finding the right balance between the largely cognitive focus of REBT and the largely emotional focus of EFT. Therapists must continuously assess which approach is most relevant and beneficial for the client's specific concerns. Not all clients may benefit equally from the integration of these therapies. It is essential to consider client suitability and preferences when determining whether to integrate REBT and EFT or to apply one approach more predominantly. Therapists seeking to integrate REBT and EFT must invest in appropriate training and supervision. Competence in both therapeutic approaches is essential to ensure safe and effective treatment. Finally, what are some of the key takeaways of this video? The integration of REBT and EFT offers a multifaceted approach to therapy, addressing cognitive, behavioral, and emotional aspects simultaneously. It enhances clients' emotional regulation, self-awareness, and the quality of their relationships, ultimately promoting holistic well-being.